Community Viewpoint with John Pawlak and Maria Hurst.
And welcome once again to Community Viewpoint. I'm John Pawlak, your host for this segment. And this segment is going to be talking about folks that have worked at the Nevada test site, people who have come in contact with things that may be detrimental to their health. I met some folks at the Senior Center. We tape on Friday, just a few hours ago, and they graciously accepted to be on the show to tell us a little bit about what they do. They are the Giving Home Healthcare folks, and I have with me today, I have Casey Craig, who's the founder of the group, and I'll tell you briefly a little bit about what they do, and I'll let Casey explain a little bit more. The group is focused on providing in-home health services for those with illnesses contracted in the nuclear energy programs of our country during the Cold War. The people that they serve are nuclear weapons workers, the miners, millers, and haulers of uranium. So I will send the show over to Casey and let him tell you a little about what they do and what they have to offer for the people who have illnesses because of what they've done. And Casey?
Yeah. Hey, John, it's great to be here today.
Thank you.
Thanks for having us on. It was good to meet you this morning. So Giving Home Healthcare is a home healthcare company. And we're different in a number of ways, but I'd like to lay the groundwork a little bit so people understand what we're talking about. Over the years, as the Nevada test site was in operation, there were many people who were exposed to lots of different things out there. Mm-hmm. And there was some legislation that was passed, and throughout the 90s it was in progress, but in the year 2000 it was passed, and it's called the Energy Employees Occupational Illness Compensation Program Act. Mm-hmm. And it's EEOICPA for short. Mm-hmm. We call it EOCPA. And that legislation put into law an entire program that is for the benefit of nuclear workers. So that umbrella covers the Nevada test site. It also covers uranium miners, millers, haulers that worked all over the country. It covers Los Alamos and Sandia Laboratories workers. And basically anybody that had anything to do with the Department of Energy working with weapons production at any stage of the process. Mm-hmm. And it is somewhat of an extended hand of apology by the federal government that says, we know we put you in harm's way. Sometimes people were taken advantage of. We may have known about it, we may not have known about it, but if you were diagnosed with any one of 22 different cancers, and then there's a couple of other illnesses.
You're talking about asbestosis, mm-hmm. from the miners, berylliosis. We talked about earlier, there was a building at the North Losey Road complex for DOE that it's not there anymore because it had beryllium in it. Yeah. And there was an issue with that. So they said, yes, it did, mm-hmm. and the building's not there anymore. So those people may have some claims with you. Silicosis, mm-hmm. Give me a hand with
pneumoconiosis.
Thank you. Pulmonary fibrosis, mm-hmm. COPD, and other.
Yeah, there's a host of others.
Yes.
And a lot of those illnesses, they're a direct result of toxic exposures, whether it be a radioactive exposure, mm-hmm. or exposure to solvents or heavy metal-laden chemicals that bring these things on. So if you're a Nevada test site worker, up until the end of 1992, they have what they call a special exposure cohort. What that means is if you were diagnosed with any one of these diseases and you worked here for 250 days or more, you automatically are approved. And what that means for you is it's actually a $150,000 settlement, mm-hmm. that comes to you, and it's a non-taxable settlement. And then you receive a benefits card, and the card is essentially an insurance card. And I think we've got a small picture of the...
Yeah, the banner's over there.
Yeah.
It's on the banner.
On the left,
right.
And where it says, do you have this card? And then right below that is what the card looks like. And on the front of that card, it's got diagnosis, the DX, and then those numbers. I think this example says 505 a couple times. Each one of those numbers stands for an illness that you were diagnosed with.
Right.
And then you receive 100% medical benefits and coverage for those illnesses. And that covers a broad spectrum of things, everything from travel reimbursements, the cost to see a specialist, tests, and finally it comes down to home health care. And that's where we come into play. So the program, although it has to do with Department of Energy workers, it's administered by the Department of Labor.
Okay.
And so we work with the Department of Labor as an authorized provider under the EEOICPA program.
Interesting. Then we were talking about medical screening also for the folks. You want to tell us about that? Is that for these people from 1992, or is just that?
Yeah.
How do I apply for that and
Okay.
accept it for that, or someone?
Yeah, so that's a really good question. So I brought up the 1992 cutoff. It's important to note that the 1992 cutoff is just for that special exposure cohort. After 1992, if you work there, you can still apply, but the burden of proof is more upon you to demonstrate, hey, here's the study that says this exposure equates to this illness. And the reason why they changed that is because their records and documentation up until that date are a little bit foggy or not complete.
Right.
From there forward, they say our safety requirements were improved and our records are clear. So then it's a few more hoops you have to jump through. But there is a free screening service here in Southern Nevada. It's in the Las Vegas Valley in the Northwest. And it's run the program is called RECEP, Radiation Exposure Screening and Education Program. And anyone who has the work history can go there and get tested, or if you lived in the area during the time of open air detonations, you can go and get screened for any one of these cancers or illnesses. It's free of cost, and you can go once every 2 years. So
who are they contacting, you or?
No, you contact RECEP directly, and it's run. My understanding is that they're associated with UNLV, but the phone number for them, if we can mention that, it's 702-992-6887, and you can call them and get screened free of cost if you have a concern that some exposure may cause one of these illnesses.
If you think you're a downwinder, or if you had some issues that are wrong with you now that you think may be due to your exposure at the Nevada test site or during the times that the above ground testing was happening. So that's 702-992-6887, and it's for what's RECEP stand for?
RECEP, Radiation Exposure Screening and Education Program. That's what that stands for.
Okay, you left some of these over at the senior center then, I hope?
We did, yeah.
Okay,
Yeah,
so there's information on the placemats, and so the information that we're giving you today is on here. Which way? That way. Okay, this way, this way. Okay. So anyway, well, thank you for that.
You bet.
And what else do we want to know that we need to know?
Well, I'd like to share with you how this is different than traditional care.
How is that different from, let's say, Nathan Adelson Hospice we have here?
Okay.
That's for I'm dying, I'm bedridden, and I know what they do. They have nurses that come over, they have doctors come over, that you can get your prescriptions brought to you. So, and how do you differ from the good folks at Nathan Adelson?
Yeah. So this card that you receive from the Department of Labor offers you probably the most comprehensive coverage of any insurance program out there I know of. The limitation is it's for just those covered illnesses.
Right.
You know, if your knee's hurting, but your coverage is for, let's say, brain cancer, they're not going to cover treatment for your knee. But if you need assistance for the cancer in any way, they'll go all out. So traditional home care or even hospice is more of an end-of-life experience.
Right.
And typically you are bed-bound or at least home-bound at a minimum. With this program, you can apply at any time. And we have a number of patients and we'll call them patients. Sometimes the Department of Labor will call them claimants. But we have a number of patients that they have a nurse that comes to their house once a month. And it might be to make a 2-hour visit. The nurse will take your vital signs, do a head-to-toe assessment, and then spend some time with education and training. And that's in an effort to simply monitor the illness and make sure there's no changes. And the reason why that's important, and the reason why the Department of Labor will approve that, is because these illnesses from these exposures, they're pretty serious. They're chronic and oftentimes very terminal. And so keeping a close eye on that's very important. So it's one of our goals as Giving Home Health Care to say, anybody who has this card, or you think you're eligible for one, we need to talk to you because you need to get monitored. And then as things change and you realize, hey, you know what, I can't quite do for myself what I used to do, maybe I should talk to my doctor and ask for this to be increased a little bit and adjust it accordingly. No other program I know of does that. And so we're the individuals who have this, even though you may say, hey, that extended hand of apology is inadequate, I'd rather not be sick.
Yeah, it's a different program.
Yeah. It is something.
Yes, it is. Especially when people are without basic health care. We lack that in Pahrump and the rural areas. So something like this, it helps, especially with the people who had worked previously at the Nevada test site, or in the uranium mines, or milling.
Or Yucca Mountain mines, you know. Those gentlemen are eligible too. Even though it wasn't actively put into operation, those who helped construct it are covered under the same program.
Yes, we had some issues with that, but that's a different program too. But yeah, I appreciate that. And we've got a minute left, so if you want to give us some basic things that we need to know to come see you, how do we get in touch with you? And
well, we'll come to your home and sit down and discuss it with you. We can answer questions on filing for a claim. We can answer questions on how do I apply for the home care program? Am I eligible? We can help you understand what's on your card and what's covered and what's not covered. If you're with another company, and we do have a few competitors that deals with this program, and things aren't working correctly for some reason, let's have a conversation, because the program belongs to you. You're able to transfer at any time and make a change. The approval belongs to you, the claimant, not to the home care company. And there's so many different levels of care. It can be nursing, it can be home health aid that helps with more of non-clinical activities. It's a combination of the both, all the way up to 24-hour care. And I'll tell you what, it makes an amazing difference in the lives of these people. It really does.
I really appreciate the time you spent with us, and thank you for coming. And let's get the message out there. Thank you very much.